One familiar compound that's gaining some attention and traction recently is leucovorin or folinic acid, especially pertaining to its usefulness in autism. Now, autism spectrum disorder affects about 1 in 35 kids, and certainly genetics and environment play a role. But some science recently has suggested that there may be ways to treat some metabolic glitches, and that's where folinic acid or leucovorin come in. A physician, Dr. Richard Fry, has done some studies on folinic acid, and he's had some really successful results. What we know is many kids with autism, they have low cerebral folate, so that's folate in their brain. And the reason is because there's antibodies which block this folate receptor, and that starves the brain of this essential B vitamins. These B vitamins are essential for neurotransmitter formation. In 2018, Dr. Fry and his team published a paper where they treated high-dose folinic acid or leucovorin at 2 milligrams per kilogram per day on 48 children. 48% of them showed significant improvements in verbal behaviors and stereotypical behaviors versus just 11% on the placebo. They did MRIs on these kids and they revealed normalized activation in language centers, which meant folate was probably doing its job in helping. Folinic acid, this form of folate, does cross the blood-brain barrier. The cool thing about it is it's very well tolerated. If you use this, especially in kids that are known to have this positive folate receptor antibody, turns out that the clinical utility is quite remarkable. And while leucovorin or folinic acid certainly isn't likely to be a cure-all, it does offer some hope in improving symptoms in these desperate parents who have children with autism. So if autism is something that you've been navigating, you or a loved one is dealing with, have you heard of leucovorin? Have you tried folinic acid? Have there been other things that you found successful or are looking into? Let us know by dropping a comment below.